Assalamualaikum warahmatullahi wabarakatuh. Hello everyone, good morning. I'm Anissa Nadia Purnama and I'm from SMKS Kesehatan Bakti Kencana Subang. And my serial number is 13. And in here, I will explain about optimizing care for the elderly with hypertension and paralysis due to stroke. Definition of cardiovascular. The word cardiovascular comes from the Greek word cardia for heart and the Latin word vasculum for small vessels. Cardiovascular system is the system that generally plays a role in circulating blood throughout the body, transporting oxygen and nutrients to all body tissues, and transporting all waste products. This system includes the heart, blood vessels, and blood. The heart is a hollow, muscular organ that pumps all the blood up to about 5 liters through the body about once per minute or faster during exercises. Cardiovascular system. Diseases of the cardiovascular system are primarily caused by dysfunction of the heart and blood vessels. In Indonesia, cardiovascular diseases result in approximately 651,481 deaths annually. These diseases are particularly dangerous because they can develop without symptoms or discomfort. As a result, the disease may only be detected once it has reached a sufficiently advanced stage, potentially leading to dangerous complications. Unhealthy lifestyles such as excessive fat intake, lack of regular exercise, smoking, and excessive alcohol consumption are among the risk factors for cardiovascular disease. Diseases of the cardiovascular system. Stroke is a disease caused by acute neurological deficits due to sudden or abrupt disruption in blood vessels leading to the brain, which can result in physical disability or death. Hypertension is an increase in blood pressure, both systolic and diastolic, divided into two types: essential hypertension, which is the most common, and secondary hypertension caused by renal disease or other causes. Malignant hypertension is rare. Fulminant hypertension often found in both types of hypertension. Pathophysiology of stroke due to hypertension. Pathophysiology of ischemic stroke. Ischemic stroke or non-hemorrhagic stroke occurs when the blood vessel supply in the brain become blocked. 90% of strokes are of the ischemic type. The underlying cause of ischemic stroke is the buildup of fat on the walls of blood vessels, known as atherosclerosis. Cholesterol, homocysteine, and other substances that adhere to the arterial walls can form sticky substance called plaques. These plaques can accumulate, impairing blood circulation and potentially leading to blood clotting or thrombosis. Pathophysiology of hemorrhagic stroke. Hemorrhagic stroke occurs when a blood vessel ruptures in the brain parenchyma, leading to a hematoma due to the neurotoxic effects of blood component and tissue damage. The extent of the hematoma can increase intracranial pressure in the brain, causing erythrocyte lysis or red blood cell breakdown, the release of hemoglobin, heme, and iron, and the formation of free radicals through oxidation. This oxidation damages proteins, nucleic acid, and carbohydrates, leading to cell death or necrosis. Hemorrhagic stroke is often preceded by high blood pressure. Hypertension is the strongest risk factor for hemorrhagic stroke in both men and women. Management of cardiovascular disease, stroke, and hypertension prevention. Hypertension management can be done in two ways. Non-pharmacological management of the hypertension includes weight loss if overweight, increasing physical activity, reducing sodium intake, reducing caffeine and alcohol consumption, complementary and herbal therapies. Pharmacology or medication use include beta blocker, example propranolol, angiotensin converting enzyme inhibitor, example captopril, angiotensin II antagonist, example candesartan, calcium channel blockers, example amlodipine, and alpha blockers, example doxazosine. Stroke prevention. Stroke prevention aims to control the mortality rate due to stroke and stroke incidents, reduce the likelihood of disability due to stroke, and prevent recurrent strokes. Forms of stroke prevention efforts that can be carried out: A. Primary prevention. Primary prevention is prevention carried out on healthy individuals or at-risk groups who have not yet experienced a stroke to prevent the possibility of a first stroke by controlling risk factors and detecting stroke attacks. This can be achieved through increasing physical activity, providing healthy food, and accelerating nutritional improvements, improving disease prevention and early detection, improving environmental quality, enhancing healthy living education, promoting healthy living behaviors implemented through the cerdik approach. C kesehatan secara berkala. E-nya asap rokok, R rajin aktivitas fisik, D diet sehat dan gizi seimbang, I istirahat yang cukup, dan K kelola stres. B. Secondary prevention. Secondary prevention is a prevention carried out on individuals who have already experienced a stroke to prevent recurrent strokes such as adding blood thinning medication like aspirin. In addition to controlling other risk factors for stroke, individuals should regularly and consistently monitor their risk factors. Efforts to improve quality of life in the elderly with stroke and hypertension. Improving the quality of life for stroke patients with hypertension. Stroke is a disease that affects the central nervous system, but its effects can impact the entire body, according to the National Institute of Neurological Disorders and Stroke. Possible effects may include 1. Paralysis. The typically occurs unilaterally hemiplegia, and the paralysis occurs on the opposite side of the brain hemisphere, where the lesion is located. Paralysis can cause difficulties in daily activities such as walking, dressing, eating, or using the bathroom. Some stroke patients also experience difficulties swallowing or dysphagia. 2. Cognitive function deficits. Stroke can cause problems with thinking process, attention, learning, decision-making, and memory. Severe cognitive deficits can lead to condition known as apraxia or agnosia. 3. Language deficits. Stroke patients often have difficulty understanding or aphasia, or forming word dysarthria. This is caused by damage to the left temporal region of parietal lobe of the brain. 4. Emotional deficits. Stroke patients may have difficulty controlling their emotions. Depression is common in stroke patients. Post-stroke depression can hinder recovery and rehabilitation and may even lead to suicide attempts. 5. Pain. Pain, strange sensation, and numbness in stroke patients may be caused by various factors, including damage to the brain, sensory regions, stiff joints, and paralyzed limbs. Unusual pain in stroke patients is called central stroke pain or central pain syndrome. CPS is caused by damage to the thalamus. The pain is a mixture of head, cold, burning, stinging, numbness, and a pricking sensation. The pain is more severe in the extremities and worsens with movement and temperature changes, especially cold. In efforts to improve the quality of life for stroke patients with hypertension, first identify the complaints and provide the most appropriate intervention. Intervention include use of assistive devices, physical therapy, occupational therapy, prescription medication, and cognitive function deficits. Cognitive rehabilitation involves providing therapeutic activities to reduce the severity of cognitive impairments following brain damage. The benefits of cognitive rehabilitation for attention deficits after stroke are unclear. Our goal is to review the effects of cognitive rehabilitation on attention, as well as on functional ability, mood, and quality of life. Language deficits. Conduct speech exercises regularly because when speaking, try to face the patient directly, speak slowly, calmly, and with normal intonation. Use short sentences and emphasize important words. Give the patient the opportunity to communicate using facial expression and body movements. Involve the patient in every conversation within the family. Tell the patient funny stories to make them feel comfortable and happy because they do not feel alone. Occasionally invite them to watch TV and ask their opinion about the movie or news program they are watching. Emotional deficits. Antidepressant or anxiety medications alone or combined with psychotherapy can reduce anxiety symptoms. Pain, non-pharmacological therapy, and pharmacological therapy. That's all from me. Thanks for watching. Wassalamualaikum warahmatullahi wabarakatuh.